have everybody with us this evening. Thanks for joining us. My name is Sanja Wilkes. I'm the Vice President of Public Affairs at the Hemophilia Federation of America, and we're really excited to have you with us tonight. As I said, I'm also a hemophilia patient, a hemophilia A patient myself. I have a son with hemophilia and a daughter with hemophilia. So glad to be here with you this evening to talk about insurance, but let's do it in a fun way because insurance often isn't fun. So how can we talk about insurance in a fun way? So with that, let's play Jeopardy, and here we go. Whoops. I forgot the Jeopardy theme song. Well, it's not going to work on me. Bummer. All right. Well, we had the Jeopardy theme song. Too bad. You guys all know it. But we'll start with our sponsors this evening, and just want to say thank you once again to our symposium sponsors. We really appreciate their support, and we're really looking forward to being able to see folks in person, hopefully, fingers crossed, in April in San Antonio next year. If you haven't had a chance to go check out our exhibit hall yet, we really strongly encourage you to do that. There's some really great information in all of the booths and sites this year. As a reminder, though, as we start Jeopardy this evening, all attendees will be in mute only. However, there is some audience participation poll questions, so be sure to be on the lookout for those and join us. You're also certainly welcome to use the chat and the Q&A to answer our Jeopardy questions, or just to ask any further questions about anything that you see during tonight's game. If you have technical difficulties within the chat, please call it out, give us your concern. You can either use the chat or the Q&A, or go over to our Slack environment and use the hashtag helpdesk community to voice that concern. So with that, let's meet our contestants and let's play Jeopardy. So if our contestants want to join me on the screen, that would be great. We'll go on and pull you guys in and introduce everybody. So Nick, I'll start with you. Mind sharing a little bit about yourself?
Yeah, I'm Nick McRae. I'm from Maine. I have Williams disorder type 2A, and I work with HAM and NEHA and the New England Bleeding Disorders Advocacy Coalition. So it's pretty cool up here.
Awesome. Good to see you, Nick. Nick has participated in HFA's Young Adult Advocacy Summit and a few other events with us, and Nick's a great guy. We're glad to have you with us tonight, Nick. Dan, how about you?
Hi, I'm Dan Lytle. I'm from Morgantown, West Virginia. I have severe hemophilia A. Currently, I'm a doctoral student in sociology, and I've done advocacy and all kinds of volunteering for various hemophilia organizations around this nation and in West Virginia. So that's me.
Thanks, Dan. Good to have you with us this evening. And Bree, tell us a little bit about yourself.
I'm Brittany Vieira, and I'm from New England Hemophilia Association. I've done work with them for a very long time, over 25 years. I also am on the board of directors for HFA. And I'm from Massachusetts, and I have von Willebrand's disease type 1.
Thanks, Bree. Appreciate you introducing yourself. So as I said, these are our 3 on-air contestants, but feel free, those watching this evening, to answer the questions in the chat and the Q&A as well. So just a few little rules of the game here as we go forward. I remind our contestants to give your answers in the form of a question. I feel very Alex Trebek here. My decisions are final, but I will say we have vetted this presentation for the correct answers very well. And again, we really want the audience to participate, and the poll questions are special. So please make sure you pay attention and be ready for those. So let's play. Our categories today are the basics, resources, types of insurance, policy, and the Affordable Care Act. All right. Let's see. I'm going to call upon Dan first. Dan, where would you like to start?
Let's go for the basics for 100.
All right. So a monthly or annual payment you make to your insurer to get and keep insurance coverage.
What is a premium?
Let's see. That is right. Thank you, Dan. And I should mention to our audience, we're not keeping score this evening. If you remember the old improv show, Whose Line Is It Anyway? The points don't matter tonight. So we're taking some liberties with the Jeopardy rules here. But Dan, I'll let you go ahead and choose the next on our board.
Let's continue on basics for 200.
All right. A physician, nurse, skilled nursing facility, home health care agency, or any other duly licensed or certified institution or health professional under contract with your insurance provider.
Mimi,
Brittany.
PCP.
Oh, let's see. I don't think that's quite right.
Yeah. What is a PCP?
No, well, good catch on the question, Nick.
What is an in-network provider?
That is what I was looking for. Absolutely. Thank you, Nick. All right, Nick, you'll get the next run of the board here.
You know what? Let's keep with the basics for 300.
Stay with the basics. All right. So basics for 300. The amount you owe for healthcare services, your health insurance or plan covers before your health insurance or plan begins to pay.
What is a copay?
Dan, what is a copay? Oh, I even had it wrong.
Deductible.
It is
Oops.
a deductible. It is a deductible. So sorry, audience. Yes, thank you. What is a
New
deductible?
host.
I'm sorry.
New host.
New host. Who this? Still working out the kinks. All right. Brittany, why don't you go ahead and choose for us our next one?
Types of insurance for 100.
Types of insurance for 100. Health coverage for people who receive insurance through their work.
What is a... I do this and I said this the other half, but I have a brain fart.
Nick's ready. Mickey, 3, 4.
What is employer-sponsored coverage?
I believe, yes, employer provided health insurance. Absolutely. Lisa Perez from the chat says, what is a group plan? Yep, that would be an excellent alternative answer there. Yeah. All right. Bree, go ahead, choose again.
Resources for 100.
Awesome. Name 2 national organizations that offer programming and other assistance for people with bleeding disorders.
Ding,
What is
ding.
NHF and
Oh,
HFS?
I saw Nick's hand first. I'm going to go with Nick.
I'm just going to steal Bree's answer and say National Hemophilia Foundation and Hemophilia Federation of America.
That is correct. And let's not forget Coalition for Hemophilia B, the Committee of 10,000, Hope for Hemophilia, amongst others. But yes, the NHF and HFA are the 2 that come to top of mind. All right, Dan, let's come back to you.
Let's do policy for 100.
All right. A federal law that may allow you to temporarily keep health coverage after your employment ends. You lose coverage and as a dependent of a covered employee or another qualifying event. And I saw Bree really excited to answer.
Because I was on this. Cobra.
Cobra. What is Cobra? Yes. And we very rarely think about the full name, but Consolidated Omnibus Budget Reconciliation Act. Cobra. It's Cobra very rarely. So let's take a minute. Let's do an audience polling question here and let our audience jump in on some fun. So what does HDHP stand for? Is it high definition home projector, high deductible health plan, or hugely destructive horseplay? Take a minute to see what everybody thinks. as I mentioned, we're having a little bit of fun with the poll questions this evening. Give it another minute or two. I see almost everyone's participated. Just imagine you're just now joining in and this is the poll question up and you're wondering, what have I got myself into? All right, we'll end the poll. And yes, the answer is high deductible health plan. Absolutely. All right. Let's see here. We'll go back to our board and Nick, I'll come to you.
Let's do Affordable Care Act for 100.
Awesome. This provision allowed young people to extend their health care past 19 years old or when a student was enrolled in college full time. As Adar just said, let's embrace the silence. I'll give you guys.
Me?
Go ahead.
What is something about 20, like age 26? I can't.
Something
quite
about
remember.
age 26. That's the right age. It is staying on your parents' insurance until you turn 26. Hugely vital for our community. And actually, we have a really great document on our website called Turning 26. And I'll ask my colleagues that are joining us on the back end if maybe they can drop that link in on the chat, because it's a really helpful document to help as you are aging out of your parents' insurance and looking for your own coverage. Great resource that we have available. All right, let's see. Dan, go for it.
Now let's switch things up. Types of insurance for 400.
Oh, types of insurance for 400. The resource where individuals, families, and small businesses can compare health insurance plans for coverage and affordability. Bree's got it again.
Marketplace.
What is the marketplace?
What is the? I told you I was gonna forget that.
We're playing loose and fast, but yes, what is the health insurance marketplace? And again, a really great resource for folks to look up, healthcare.gov. Easy, simple website to look for, and open enrollment on the healthcare marketplaces will be opening on November 1st. So good time of year to start looking for next year's coverage. Nick, let's go to you.
Let's try policy for 300.
Policy
Moving
for
around.
300. All right. This drug program enables eligible healthcare organizations to purchase drugs from manufacturers at reduced prices. Nick.
I know this one, I think. The 340B program.
Yes, what is the 340B drug pricing program? So many, not all, federally funded hemophilia treatment centers have a 340B program that provides factor and other medications for bleeding disorders. Great question. All right, Dan, let's go back to you.
Let's see. Basics for 400.
Basics for 400. Ooh, it's the daily double. The sound effect actually played for that one. All right. A fixed amount, for example, $15 that you pay for covered healthcare service, usually when you get the service. Dan.
This was the copay.
This is the copay. Absolutely. What is the copay? Thank you. If you missed us earlier, we had a little bobble with a question, but we got it right this time. What is a copay? All right. Let's see, Bree.
Resources for 300.
Resources for 300. An individual or organization that's trained and able to help excuse me, let me start over. An individual or organization that's trained and able to help consumers, small businesses, and their employees as they look for health coverage options through the marketplace, including completing eligibility and enrollment forms.
What is Navigator?
That's correct. What is a navigator? Awesome. And again, check on healthcare.gov. It'll list navigators in your area.
And I know in some places they call them different things, like in Massachusetts, sometimes they call them CACs.
What does that stand for? That one's new to me.
Certified Application Consultant or something. I don't know, but that's kind of what they call them at community health centers. So sometimes it can be a little different.
If I was giving out points, Nick, I'd give you some extra points. Oh, let's see. Let's go. Nick, while we're talking, let's go back to you. Let you take our next one.
Let's try resources for 500.
Resources for 5. All right. This U.S. Department's mission is to enhance and protect the health and well-being of all Americans by providing for effective health and human services and fostering advances in medicine, public health, and social services. Dan, I saw your hand.
Department of Health and Human Resources. Or
Ooh,
services.
services, there we go. Yeah,
It's resources in West Virginia.
see, and that's a great point. So, you know, what is called one thing at the federal level might be called something else at the state level. I know here in Colorado, it's the Department of Regulatory Affairs, DORA. And when we first moved to Colorado, I couldn't figure out who DORA was because I thought she was looking for an adventure with backpack. So certainly can be called something in different areas. Let's go back to the board, and Dan, I'll stick with you.
Affordable Care Act for 400.
All right, Affordable Care Act for 400. Organization that was created under the ACA to fund research that can help patients and those who care for them but make better informed decisions about the healthcare choices they face every day, guided by those who will use that information. Ooh, we maybe have stumped the contestants. Let's go to the chat. Anyone in the chat? I'll give you a hint. HFA has 2 funded research projects through this organization.
Is it?
Dan?
Is it like a community advisory board?
Not quite. Not quite. I'm starting to see it in the chat. I'll give the contestants another second here. Okay. Oh, I like it when we stump people. This one's fun. What is Patient Centers Outcome or Research Institute, or PCORI? So if you missed it last week, we had a great recap of our first project, which is about research in women. So if you missed it last week, that recording is there, but that's one of HFA's PCORI funded projects. So good job. Thanks to the chat. I see lots of right answers in the chat. So good job. So while the audience is on a hot streak, let's give them another poll question and see what this next one is. So what is medical underwriting? A job where you take notes for a doctor? Second guessing the treatment plan prescribed by your hematologist? Or pre-ACA practice of denying health insurance or charging higher premiums based on a person's health status? Again, we'll give the audience a few seconds here to throw their answers in. Oh, everybody was quick to answer this one tonight. I believe that's everyone. Yes, and medical underwriting was a pre-ACA practice of denying health insurance or charging higher premiums based on a person's health status. So in the past, women were automatically charged higher, or depending on where you lived, or depending on lots of other factors that, quite frankly, weren't necessarily within your control. Medical underwriting was a great aspect of the ACA. Let's see who wants to choose next. I'll let you guys fight for the battle here.
Go ahead, Bree.
Thanks. I'm trying to figure out which one I want to do. Let's do types of insurance for 200.
Types of insurance for 200. Sorry, I had a moment there. All right, a healthcare program for active duty and retired uniformed service members and their families. Bree.
What is Tricare?
What is Tricare? That is right. Very good. All right. Who wants to go next?
ACA for 300.
ACA for 300. Routine health care that includes screenings, checkups, and patient counseling to prevent illnesses, disease, or other health problems. Nick.
What is preventative health?
That
Preventative
is
care?
right. Preventative services, close enough. Preventative was the key word, absolutely. And again, a really important provision of the ACA. So many people forego having these services done prior to the enactment of the Affordable Care Act. All right, Dan, I think you're up.
Types of insurance 500.
Types of insurance for 500. A state-administered health insurance program for low-income families and children, pregnant women, the elderly, people with disabilities, and in some states, other adults. Dan.
Medicaid. What is Medicaid?
What is Medicaid? All right, bonus question, and we'll see it. We'll go to the chat here with the audience. What 12 states have not expanded Medicaid? Let's see if we can get those in the chat. And I'm going to have to use my cheat sheet off to the side of my desk here to remind me. But what 12 states have not expanded Medicaid? Let's see. And contestants, feel free if you know any of them to chime in.
Mississippi.
Mississippi, Florida, yep. North Carolina. Oh, this person's got a bunch of them. Georgia, Texas, North Carolina, South Carolina, Arizona, I think expanded, didn't they? Yes, they did. Mississippi, Florida. Oh my goodness. Thank you, Miriam Goldstein. Miriam Goldstein, our policy director extraordinaire here at HFA, through the map in, but let me call it out from my cheat sheet over here. North Carolina, South Carolina, Georgia, Florida, Alabama, Mississippi, Tennessee, and Kansas, Texas, Wyoming, South Dakota, and Wisconsin. Are the full 12, but be sure to check that link that Miriam put in the chat. That is the most up to date. There we go. All right, Nick, let's come back to you.
Let's try Affordable Care Act for 500.
Affordable Care Act for 500. The maximum amount you will be required to pay for covered services in a year before the plan covers 100% of all costs. Nick.
I know this one. I reached it in January. It's the out-of-pocket max.
Absolutely, your out-of-pocket maximum. And I think it's safe to say many of us in the bleeding disorders community hit that January 2nd or 3rd, whatever that first business day of the month is, but absolutely out-of-pocket maximum. All right, Bree.
Let's go basics 500.
Basics for 500. A list of prescription drugs covered by a prescription drug plan or another insurance plan offering prescription drug benefits. Nick?
What is the formulary or
That is correct. The formulary, also known as a preferred drug list, or PDL, you may hear here. We love acronyms in policy and advocacy, but typically referred to as a formulary. All right, Bree.
Let's do Affordable Care Act for 200.
Affordable Care Act for 200. A set of 10 categories of services health insurance plans must cover under the Affordable Care Act starting in 2014. Nick.
Essential health benefits or EHBs.
Very good. Essential health benefits.
Didn't ask it as a question.
You didn't ask it as a question, but that's all right. That's all right. But yeah, the chat is interesting because some folks are getting the question or the what is part and some aren't, but we're like I said, we're playing loose and fast with the rules tonight.
Well, he said it questioning, so.
There you go. It had the question, the lift at the end. All right, Dan, how about you?
Resources for 2.
Resources for 2. Co-payments and out-of-pocket expenses can be devastating on a family's budget. These programs can offer a source of relief.
What are benefit assistance programs?
That's not the answer I'm looking for, but that's a good guess. Bree?
I was going to say what is copay assistant, but I'm not sure if that's right either.
That's closer.
Patient assistance or?
What are patient assistance programs? Yes, absolutely. And again, I'll ask my colleagues to throw a link to that on HFA's website. We have a really great patient assistance portal that has been put together by my colleagues that work on our Helping Hands program that list out all sorts of resources that you can turn to should you need assistance. So there you go, Miriam, once again, right on the ball. Let's see, Nick, I'll come to you.
How about policy for 400?
Policy for 400. This law provided payments with regard to individuals with blood clotting disorders such as hemophilia who contracted human immunodeficiency virus due to contaminated blood products or for other purposes. Dan.
What is the Ricky Ray Act?
Correct. The Ricky Ray. Ooh, I just lost my mouse. There we go. Let's try this again. The Ricky Ray Hemophilia Relief Fund Act of 1998. Really important piece of legislation in our community's history, and so many folks worked on it, and just very grateful that we were able to get those funds passed for our families. All right, we have 4 questions remaining. Who would like to choose the next one?
Policy for 2.
Policy for 2. The Comprehensive Healthcare Reform Law enacted in March 2010. Bree.
What is the ACA?
That's correct. What is the Affordable Care Act? Very good. Very good. Let's go to another polling question. So let's check out this next audience question. And this question is, what are premium tax credits? They're an extra special IRS line item. They're getting a high score on the final exam in an accounting class. Are subsidies that help you pay the premiums for ACA health insurance. Watching audience fill out that poll question. Give it just a few more seconds here. Great, and it is subsidies that help you pay for premiums for ACA health insurance. And I didn't hit the share button, that would help. But as part of the American Rescue Plan Act enacted earlier this year or late last year, as COVID relief, those subsidies did improve quite a bit. And so lots of folks are able to get plans on the marketplace for much, much cheaper than before. So if you've checked before and thought maybe it was a little too expensive for you, check again. And we're hoping that as part of the Build Back America legislation that's currently before Congress right now, those subsidies will be made permanent. We talked a little bit more about this in our insurance barrier session that we had during symposium last week, so be sure to check that out. And we also had a webinar earlier this year that had some more information about those subsidies. I'm going to ask my webinar support folks to help me out here because I'm having trouble getting the poll to leave my screen. So if someone could help with that, and maybe I'm just failing, I don't know. Keep trying here, maybe. Sorry, guys. There we go. Gotta love Zoom, right? All right. Let's go back to our board. And Nick, I think we're to you.
Types of insurance for 300.
Types of insurance for 300. All right. Type of plan usually present in larger companies where the employer itself collects premiums from enrollees and takes on the responsibility of paying employees and dependents' medical claims. Got someone in the chat that knows it.
Is it self-funded? What is a self-funded or self-insured plan?
That is correct. Yes. So what is a self-insured plan? And quite often these plans have provisions that aren't always helpful. So you know, just be aware if you are under a self-insured plan, be sure to give us a call and we'll help you as much as we can as you navigate a self-insured plan. All right, 2 more questions. Let's see, Dan.
Resources, 400.
Resources for 400. A person or department where you can go for help with employee benefits, including health insurance. Dan.
What is human resources?
That is correct. What is your human resources, HR coordinator or department? Very good. Got a few more polling questions, so let's hit another one of those and see what our next one is here. So what is a lifetime cap? Is it LL Bean headgear guaranteed to never wear out? A limit on the number of Christmas movies shown on cable's TV's Lifetime channel? Or pre-ACA, a limit on how much care some health plans would pay for?
They really
Nick,
should have that second one.
I'm guessing, Nick, that might be an LL Bean beanie on your head with you being from Maine. Is that right?
Yes.
Yep. And Dan, I believe those Christmas movies have begun already playing on Lifetime. Yeah.
Yes, they have. And Hallmark.
And Hallmark. Okay, great. So yeah, gotta get those holiday movies in.
Do they ever stop?
Not when you watch them on Netflix.
I'm a big fan of National Lampoon's Christmas Vacation, I must say. So yeah, the lifetime caps are pre-ACA limit on how much care some health plans would pay for, and many in the community know my family's history with lifetime caps. I mean, that is absolutely what started my family's journey in advocacy. We hit 2 separate $1 million lifetime plans before my son was 4. It was terrifying, absolutely terrifying. So someone in the chat says they hit 4 of them. Yeah, it was just absolutely terrifying. Dan, you hit 3. So very, very happy to see the elimination of lifetime caps. All right, I think we have 1 more or 2 more polling questions. Let's go on and hit 1 more of those before we go back to the board. So what are exceptions and appeals? A new courtroom drama on CBS, the process you go through to challenge a health plan's denial of coverage for a product or service, or negotiating with your 9-year-old over how much screen time they're allowed. What are exceptions and appeals?
I think all 3.
I think very timely. Dr. Balloon's session just before this was talking about tweens and teens and proper lifespan development. So I see someone in the chat says, or an 11-year-old tween who thinks they are 18. Don't all 11-year-olds think they're 18? So,
Or 30.
or 30, yes. Yeah, so absolutely, exceptions and appeals are a process that you go through to challenge a health plan's denial or coverage for a product or service. And again, we talked about exceptions and appeals during our session last week that was insurance barriers to care. So if you missed it, be sure to go back and check that out. And I don't think I ever shared the results. Sorry about that. Having quite the time here with my little Zoom windows. Sorry. All right, let's go back to the board and get our final question here. Sorry. Zoom is giving me a fit here. All right, policy for 500. This act allowed the establishment of federally funded comprehensive hemophilia treatment centers. Who would like to answer this one? Bree.
The Hemophilia Act of something 70s.
Yes, the Hemophilia Act of 1973. And again, a very important act for our community. Established the comprehensive care model that many of us use and rely on today. I call it one-stop shopping because you've got your hematologist, your nurse coordinator, your physical therapist, social worker in lots of places, geneticist, dentist, orthopedist, just all kinds of folks who are familiar with bleeding disorders care in one place. So 1 more polling question before we go to Final Jeopardy. So I'll let our contestants get ready for Final Jeopardy and we'll go to the audience for that final polling question. So what are bronze, silver, gold, and platinum? Gifts for the 5th through 50th wedding anniversary, eras in human history, or tier levels for ACA health plans spanning a range of premium, network, and benefit levels. Awesome. Let's go ahead and end the poll here. And that's right, they are tier levels for ACA health plans that span a range of premium, network, and benefit levels. And again, when you're looking at those plans, make sure you do compare between all. Just because it's platinum doesn't mean it's the best. Just because it's platinum doesn't mean it's the worst, or it's the worst. So do take a look at all the different levels and see what the options are that each one may offer. So let's go back to our board and let's go to Final Jeopardy. Contestants, are you ready? All right. So Final Jeopardy category is applying for insurance. And the question is the yearly period when people can enroll in a health insurance plan. And let's see if the Jeopardy theme song works. Yay. There you go. There's your theme music. Audience knows this song. Very proud of myself that we made the music play. That is quite an accomplishment. And the correct answer is, what is open enrollment? And what does everybody have? Yay! Everyone got it correct. The audience got it correct. Really, really happy that everyone got that. And as I mentioned earlier, open enrollment for marketplace plans opens on November 1st. Medicare plans are actually open right now. It's open enrollment already for Medicare plans. So be sure to check out healthcare.gov if you're starting to look for those plans, and know that if you need assistance looking at a plan and helping determine if it's right for you, our policy team here at HFA is here to help. We're advocacy@hemophiliafed.org. We're happy to help you look over any plan that you might have. That is our Jeopardy game for this evening. I will give it a second here for the audience. If the audience has any questions that maybe we didn't answer, any just general health insurance 101 type things, I'll stay here just for a second and look and see if we have any chat questions or anything else. And many thanks to this teacher from Franklin Public Schools for his great work in a template. Wouldn't have been able to do this without them. What states use copay accumulators? Most. I would venture a guess to say almost all 50. There are 12 states that have enacted state-based legislation that offers some protections. And we'll throw that information up in our chat here, a link to a site that lists all of those states that have state-based protection. But there is hope that there will be some federal legislation introduced soon that will address the issue of copay accumulators. Great question. Great question. And yes, that's correct. Some of the state-based legislation, like in Virginia, does not affect self-funded plans. Absolutely correct. Last call for any questions, comments. Well, I just want to say thank you to Nick, Dan, and Bree. I'm not quite sure you knew what you were in for when you signed up to participate, but I hope you had a great time. I told you you would know the answers, and you certainly did. And many thanks to our audience. We hope you enjoyed this. We were hoped that we could do some basic health insurance 101 information without the typical PowerPoint question answer definition things. So we were really hoping that you would be able to have some fun and learn more about health insurance. But again, thank you once again to our audience. Thanks to our contestants. Be sure to hang out for a second. When the session ends, the session evaluation will pop up in your internet browser. If you have pop-up windows on your or blocked on your internet browser, that session evaluation may not appear, but we do hope that you'll take a minute to fill out the evaluation. Otherwise, oh, Nick, yes.
I think someone just posted a question about assistance applying for Medicare specifically.
Oh, thank you so much. It was going quick. Yes, please reach out to us, advocacy@hemophiliafed.org. We'll be happy to help you look into that. Absolutely. Yeah, and also, North Carolina just became the 12th state to pass an accumulator, and we'll have a Dear Addie soon about open enrollment. And let me see if I can type, well, if someone from the HFA staff could just type in that email address, advocacy@hemophiliafed.org. Or you can type it in on the Slack message. Miriam says you can contact your state's SHIP for navigating Medicare, SHIPTA Center, SHIPTACENTER.org for more assistance helping navigate Medicare.
Yeah, they're called Shine counselors, the people who do it. And most hospitals also have them. So, or like doctor's offices will have someone who's a Shine counselor who's trained to do it.
Awesome. Thank you, Nick. Any more? All right. Well, we will see you everyone tomorrow evening. We're so grateful that you're spending your evenings with us last week and this week. Be sure to check out recordings and be sure to fill out that evaluation. But otherwise, have a great evening. And thank you again to Nick, Dan, and Bree. Thank you. Good night.
Thank you all.